So Kirk Cousins just had surgery to repair his ruptured Achilles tendon. He had that up here in Minnesota. In fact, it was Twin Cities Orthopedics. They sent out a tweet with him on the cover there, kind of showing his post-op pictures and, you know, wishing him the best of luck there in the Twin Cities. So you're probably wondering, how long is it going to take? What's the process like of a Achilles tendon after the surgery, the healing process? So I'm going to break down the different stages for you right now in this video. The process typically begins with the acute injuries, such as the injury with Aaron Rodgers and Kirk Cousins. It creates a gap in the tendon that separates the two torn ends. Stage 2 would be the surgical repair, which in this case could be a surgical anchor, such as the speed bridge, or just this traditional tendon repair, bringing the two ends together and tying them with sutures and then closing the skin around it. Stage 3, which might be where Kirk Cousins is still, is the inflammation or inflammatory stage. This is after surgery. The body enters this stage, and then usually this lasts for just a few days. During this, there's increased blood flow, immune cells that arrive to the injury, remove all that debris, and then start the healing process. You have a lot of swelling, redness, probably pain with this. Number 4 is going to be the repair phase. This lasts several weeks, and this is the body entering the repair phase where the actual healing of the tendon occurs. Specialized cells called fibroblasts generate collagen, the primary protein in the tendon. This collagen forms a matrix that bridges the gap between the two torn ends. And then, of course, these ends are organized in a pretty haphazard manner initially, but they start to smooth out. Rolling into stage 5. This is going to be the remodeling phase. This one lasts several months, and this is going to be probably where your Aaron Rodgers is these days now. It's involving a gradual restructuring of the collagen fibers. The fibers are realigned along the stress lines and the tension of the tendon. The goal is to restore the tendon's strength and flexibility back, hopefully, to the pre-injury levels. This phase can be influenced by a bunch of different things, including rehab, exercises, physical therapy, and even lifestyle choices. Along the way, he's going to have a lot of rehabilitation. So the big goal after surgery with the tendon is rehabilitation. Physical therapy is essential to regain strength, flexibility, functional abilities. This is going to include calf raises, stretching, eccentric loading exercises, and gait training when appropriate. So the timeline for this, the Achilles, it takes about 6 months to a year in most cases for the entire healing of a ruptured Achilles tendon to occur. Returning to sports, this often can vary by case. Now, of course, we see with Cam Akers, Aaron Rodgers, and everybody else that has exceeded the expectations for the traditional healing, he might return sooner, but it's probably going to be next season, 2024. All right. Throughout this, he's going to be having medical professionals monitor his whole tendon. They're going to be monitoring it in an interval fashion with imaging such as ultrasound or MRI. They're going to check out the tendon thickness, the alignment, the overall tissue health. You know, it just takes a long time. It's meticulous, and, you know, it's a little bit at a time, but over time, you know, it will get stronger. It will come back, and hopefully he will regain his pre-injury levels. So all the best to Kirk Cousins and his repair. He just had his surgery not too long ago, but I wanted to give you guys a little bit of an outlook of what to expect going forward. Thank you.